I am Dr. Keerthi Kundana and I am a pediatric neurologist at Ankura Hospital. Today we are going to talk about head injury. What are the signs and symptoms of head injury and when as a parent you should be worried. So I'll go in a little bit detail. So basically it's very common that whenever the toddlers or infants are learning to walk, they will fall, of course. But the trivial injuries, like whenever they are falling while walking, it wouldn't cause much of the problem to the children. However, whenever there is a significant injury to the head, it can cause problems, it can cause injury to the brain. So let's try to understand it. So this is our brain, okay? Now this is the most internal part where we have this part which is the big brain and this is the small brain, cerebrum or cerebellum as we call as. And then there are certain coverings over this which are called as meninges and dura, and on top of that there is a bone. Alright, so our brain is very much protected by these layers, and most outside is the skin. Now whenever there is injury, there can be either injury to the skin only, there can be injury to the bone, to the coverings, or to the brain itself. So depending on the degree of impact, then which of these layers will be injured, that will happen. Alright. So very small injuries will just injure the skin without impacting the brain. Little serious injuries, the high impact injuries will affect the bone and the coverings, and even more severe injuries will impact the brain also. So definitely, in which situations should I be worried? Alright. Now whenever there is a significant injury, by significant I mean fall from a height more than 4 to 5 feet height. Usually that height injuries cause injury to the brain or its coverings. And whenever there is an injury to just the coverings, blood can clot in between those layers and can cause pressure over the underlying brain. That can be really harmful. Okay. And how do we know that what are the symptoms in the child that I will see that whether there is a significant impact on the brain? The signs and symptoms would be that first, vomitings. Okay, the child will have a lot of vomitings, maybe 2 to 3 episodes of vomitings in an hour, repeated vomitings. Severe headache, the child can complain of a very severe headache. It would be so severe that the child is not able to sleep because of that. The child is crying because of the pain. Okay, there can be very big swelling over the scalp, like more than 4 centimeter, 5 centimeter big swelling which is soft, which is you can touch the swelling which will be very soft. That means the blood has collected between the bone and the skin, then you will have that soft swelling felt. Fourth, any difficulty in walking. The child is either wobbling while walking or losing balance while walking. Fifth, any visual problems, not able to see properly or having a double vision. That can be one of the severe symptoms. There can be something like a change in the behavior of the child or change in the consciousness level. The child is very drowsy, is attempting to sleep often, not interacting properly, not enough conscious enough to have oral intake, or is not responding to the questions properly. Fifth could be something like memory disturbances, like a child is not able to recall the previous facts or not able to answer to the relevant questions. So if you find any of these symptoms, or there can even be presence of seizures like fits, then if any of these symptoms happen, then you have to immediately rush to the doctor, and mostly a CT scan of the head is done to see at what site the blood has collected or injury has happened, and whether there is an internal injury to the brain or its coverings or its bone, whether it's there or not there, and if it's there, very severe amount, mild, moderate, what kind of a variety it is, and the treatment will depend on that. So it's important for you as a parent to identify these symptoms and immediately report to the doctor. Treatment is begin in time, within time, and immediately, then the outcomes can be very much good. Thank you.